Okay, guys. So today we're going to be reacting to a video on healthcare spending in America and why healthcare costs so much, essentially, in America, as opposed to it costing this much in other countries. So let's get into this.
I cannot tell you how obsessed I am with this chart. It shows exactly what is wrong with America's conversation about healthcare. On one level, you've seen this chart before. It shows healthcare spending as a share of the economy of a bunch of countries. There's Germany and France and Japan and Canada, and oh, there's America. But now I want to add something you haven't seen to this chart. This is how much of that spending in each country is private and how much is public.
Okay, so really quickly, I'm just going to go ahead and shrink that down a bit because I noticed you can't really see the chart. Probably should have picked a better placement for my face cam than right there. But we're going to talk about this chart really quickly. We see they're going to try to and explain that America has drastically more public spending, and that's why American healthcare costs so much. At that point, and I'm going to show you. I'm going to let the video play, and then after I'm going to do my little piece.
Here's what's amazing. America's government spending on healthcare, on programs like Medicaid and Medicare and the VA, our versions of socialized medicine, it's about the same size as these other countries. These countries where the government runs the whole healthcare system. And then there's our private spending. It's the private insurance system that makes healthcare in America.
Okay, so let's think about this for a second. All of these countries have similar private spending except for America. But let's talk about the fact that all of these countries have huge wait times. My teacher lives in Spain. Is Spain part of this list? Yes, it is. So, my teacher lives in Spain, my Spanish teacher. So, she, for a routine checkup for her child, had to go and wait like three or so hours. It's worse than the VA here. And the VA is a perfect explanation of how government in this country has a huge problem with taking care of its people. The VA is a perfect representation of what would happen if we let our government take complete control and nothing was left to the private sector. But also, we consistently see people trying to use this argument for why government-sponsored healthcare is perfect. That's bullcrap. And it's bullcrap for the number one reason that there are so many regulations on these companies. So many regulations by healthcare providers, companies that provide healthcare, etc., etc., that there can be absolutely no competition because everybody has to do the same thing and they charge the same amount. And government doesn't allow them to charge any less. That's why our private sector is just as much as our public sector. Because our private sector sponsors about half the nation just like our public sector does. The working population use the private sector because that's what their companies use. The ones that don't work use the public sector. And because both of them have the same regulations, they end up around the same. That's why they're so close in our country comparative to the rest of the European communist success stories, even though they're not that. Let's keep going.
So expensive. Conventional wisdom says the government is more expensive than the private sector. It can't say no, it's corrupt, it's inefficient, it's slow. You want something done right, you give it to the private sector. That is what we hear in America all the time. And yet here we are with the biggest private sector spending the most. Why is a free market so bad at controlling the cost of healthcare in the United States?
Also, I love how they don't talk about, like, individual people spending. They talk about the total percentage of our GDP that is in healthcare. Like, come on, man. You can't be giving me that crap. You don't talk about individual spending on the private sector and the public sector to show that they have similar regulations, which means they have to cost around the same amount. No, instead you just show a percentage basis on both the private sector and the public sector, not showing the individual person cost analysis, but showing the total, where some people might want heavier healthcare than others, and where some people might want or bundle health insurance and healthcare in the same package. You don't put in any of that. No. Just the total amount spent. And thinking about that, it doesn't even seem accurate. And it shows us how our government is actually laundering money on these different ways and on these different welfare programs. It just doesn't make any sense to me. It shows that we as a nation, total, spend 16.5% or around that on our of our GDP on healthcare, and other countries spend nothing near that. But they don't take into analysis the idea that we have people who study, and we also have some of the top universities in the world where they study for it. We have extremely experimental things that cost a lot of money and thus can add to that. This extremely experimental cures for diseases, the things like reconstructive surgeries, etc., etc. They don't go into detail about how other countries' medical systems simply don't do that. How other countries' medical systems simply don't sponsor any type of research at all whenever it comes to things like medication. They don't think about the fact that we are, as a nation, innovators of medicine, and have been since innovation in medicine became a topic of discussion, I would say.
If you look at the data on physician visits and hospital discharges, you can get rid of one theory. Americans don't consume more healthcare than people in these other countries. We don't go to the doctor more than the Germans or the Japanese. In fact,
okay, this is talking about annual physicians visits. That does not talk about emergency room visits. That does not talk about our constant public emergency visits. And that also doesn't actually compare the populations of our different nations to justify our spending. And again, it does not discuss the research that we put in and the amount of that money that actually goes into researching new developments.
Go to the doctor less. The difference between us and them is that we pay more. Every time we go to the doctor for everything from an angioplasty to a hip replacement, from a C-section to a pain reliever, In America, the price for the same procedure at the same hospital, it varies enormously depending on who is footing the bill. The price for someone with public insurance, like Medicare or Medicaid, is often the lowest price. These groups, they cover so many people that the government can demand lower prices from hospitals and doctors, and they get those lower prices.
Can they really? Firstly, I would like to see your data on that. Because data by the U.S. government and by the FBI and pretty much every empirical data source would disagree with you. So I want to see where your data comes from, because that doesn't seem legitimate.
If the doctors and hospitals say, they lose a ton of business. They lose all those people on Medicare, all those people on Medicaid.
But let's think about this. How many different places don't take Medicare or Medicaid and are still doing just fine? Also, you drive up the price on the private sector whenever tons of people go into the public sector. You force people to raise their prices to compensate for that lack of business in the public sector. The fact that they wouldn't be able to turn even the slightest bit of a profit makes them have to raise the price for every other person. That is another reason why the private and public sectors in this nation on our health care anyway is so close to each other in cost.
Hundreds of private insurance companies, and they each cover far fewer people than a Medicare or a Medicaid, and each one has to negotiate prices with hospitals and doctors on their own. And if you're uninsured, you have even less leverage. Nobody is negotiating on your behalf, so you end up paying the highest price.
Are you sure about that? Because then you negotiate on your own terms. And I understand whenever it comes down to this, that, and the other, it seems on a base level like a good idea to have a governmental standardized healthcare. And it does. It does seem that way. But when you actually get down to who's paying for it, because it doesn't matter whether they have low prices or not. It's low premiums for the person using it, not for the rest of the people who pay for it. And on top of that, despite the fact that Medicare and Medicaid are all used primarily in this way, we see again and again that these take away from the private sector. The private sector, and like I said before, is forced to charge more to cover the profits that they lose by people joining the public sector. They just don't make profit. And those other companies that do use the public sector, they get tons of grants from the government. That's how they're able to keep themselves open. But let's give this guy the benefit of the doubt and see what data he provides to back up his statements.
Study found that most hospitals charge uninsured patients 4 times as much as Medicare patients for an ER visit. Other countries, they don't have this problem.
And again, I say, because you screw the public sector. No. The public sector, again, screws the private sector. If you're uninsured, I'll tell you what happens. You have to pay for those who are. Because if you're insured, the government essentially twists an office's arm and tells him you have to pay, or you have to take this much, and you have to do things with this money, and that is it. You cannot charge any higher than this for somebody who is insured by a governmental program. But then people who are uninsured by Medicaid or Medicare, and I personally use Medicaid, but anybody who is uninsured by Medicaid or Medicare and doesn't want to be dependent on the government.
Hey, 12 Bible verses dealing with gambling.
Anyway, so that was my grandfather. Sorry about that. But we're going to get back into this because I'm going to start locking my door every time I record from now on, because that's not even the first time it's happened. But like I was talking about before, if you don't want to be government dependent and you don't want the government to be forcing people to tell you how much they want you to pay, then you end up paying more as an uninsured person because other people pay less. That's how they make their money. You think they can make money on what the government tells them you can charge these people? They also have deals with private insurers. And God forbid you actually don't have an insurer. Then they do whatever they want. Because they have to cover their profit spread so they can make new innovations and so they can continue to survive. They wouldn't make any money. They wouldn't be able to do any renovations to the place, hire new doctors, etc., etc., if the uninsured weren't paying higher prices. Because guess what? The public sector would fuck them. Utterly fuck them.
Instead of every private insurance company negotiating with every healthcare provider, there's just this big list. Country, the central government, they go and they say, if you want to sell to us, to all of our people, then here's what you can charge for a checkup. Here's what you can charge for an MRI.
But just in that thing, they also... this is what I'm talking about. They get these things from the government. They get these prices, but they also get grants from the government. If you don't think that these public sector insurers are getting funds from the government, you're ridiculous. You're denying the obvious truth, and you are oblivious to everything that goes on around you.
Or a prescription for Lipitor. And so then whether that bill goes to the heavily regulated private insurance companies in Germany or directly to the government like in the UK, each country is telling the doctor or hospital or drug company how much that bill will be. And because the government controls access to all of the...
Okay, let's talk about what he just said. The heavily regulated private sector in Germany. That's not an accurate comparison. Firstly, we are not Germany. And secondly, firstly, in all actuality, Germany has about maybe 30 to 50 million people. We have 318. And that's old statistics that I'm using for 318. It's no comparison. There isn't. There's more people you have to insure with the same supply. It is simple supply and demand. The more people want it or need it, the more it'll cost. In Germany, less people need it. And it's not like everything else, because it's manufactured in the country. Or if it's not, it's manufactured in a neighboring country. So you can't use that excuse that supply is the same throughout the world. Because it's not. Because private companies and public sectors all handle things differently.
customers. It's an offer that hospitals and doctors and pharmaceutical companies typically can't refuse.
I'm going to make him an offer he can't refuse.
Yeah, that offer is that we'll go ahead and sponsor you. We'll sponsor you. We'll bail you out if you fail, but you can't charge Medicaid and Medicare people or Medicare and Medicaid users this much or higher because that'll make us look bad. That's essentially what our government does. They say, we'll help you out if you get in a bind, but you can't charge Medicaid, Medicare patients and users over this much for this particular necessity. And that's ridiculous. That is what creates problems in the private sector because the private sector has to charge more to pull a profit. And whenever we think about the private sector in other nations, and we look at the tax codes in other nations, firstly, they have to wait a lot longer than we do. I went to the doctor. I saw my doctor within 30 minutes. Like I said, my teacher went to her doctor in Spain, sat in there for 3 hours before she even got to see her doctor. So, yeah. And even in the walk-in clinics, you may wait an hour and a half, depending on when you go in there. But you're not going to wait 3 hours because our private sector is like it is. Our public sector works only because our private sector also works. People want to use the private sector, or have to use the private sector in some cases because they can't afford the premiums of the public sector. But in that same regard, they help pay for the public sector. That's the way our healthcare system stays afloat. It's that simple. It really is.
In America, the idea is that you'll be a consumer, that you'll do what you do when you go to Best Buy and buy a television. But that just doesn't work in healthcare. It doesn't work in healthcare because you often come and get healthcare when you're unconscious in an ambulance, when you're scared, when it's for your spouse or your child. It is a time when you have the least bargaining power. You are not usually capable of saying no.
Really? You are not capable of saying no. Then why have so many companies regarding medications failed in the last 50 years? Why? Why does any company fail if you can't get away? We know that trusts, and this is the same problem I have with how we measure education, because it all comes from two companies throughout the entire United States. But we all know that trusts and that monopolies lead people to charge whatever they want. That's why our government has the laws that it does on monopolies. So, if our healthcare system became a monopoly, with our government being the only place to ever get healthcare, our government could then price gouge the absolute hell out of the public sector and use the excuse that it's for this reason or it's for that reason, and find some way out of it. Why is it in the private sector we have no we have a huge problem with monopolies. But then whenever it comes to government monopolies, there is no problem with it. That's a whole nother topic, but it blends with this one so perfectly because you're calling for the public sector to abolish the private sector. Whenever the private sector is the only thing that keeps a public sector afloat in our nation. The private sector in other nations is so slim to none because of harsh regulations. But also on that same scale, the public sector in those other nations has a lot more in tax dollars than you would think thrown at it. In some places in Europe, taxes can get as high as 70%. That's ridiculous. So I would expect to have free health care if I'm paying 70%, no matter what I am, no matter what I earn. I would expect to have free health care. I would expect it to come with a damn golden whistle at the end. Instead of one of those little lollipops, just like a golden whistle for 70% of every dime I make. I would expect healthcare to be free. I would expect education to be free. And I would expect it to work well. But that's just it. They expect it to work well. But then they spend 3 hours plus in an office waiting. It's just as bad as the VA, really. But that's their entire country. It's not just veterans over there. It's their entire country that has to deal with stuff like that. All of them. And it's all set by the European Union.
You're not knowledgeable enough to do it, you're not comfortable doing it, or you're not conscious enough to do it. That's why in other countries...
You just said you're not knowledgeable enough to do it. You're not knowledgeable enough to compare what is what you can afford, and if you don't need it, you don't get it. You're not knowledgeable to do that? Now you're just Hold up. Now you're just insulting people. You're just insulting people at this point. There's nothing else you're doing here.
The government is a person who can say no for you, who can say, no, that's too expensive, you're going to have to lower your price, because they do have that power.
Why in the world would somebody trust the government to do that, though? When has the government ever been a good provider for the people? And I mean a good provider for the people. Never. Because it's not supposed to be. Maybe, just maybe, if our government as a whole ran efficiently, because let's be honest, our government does not run efficiently. Maybe if our government ran efficiently, stopped complete and utter useless regulations, and worked out everything to a T, maybe, just maybe, we could work things out. But I'm not going to trust a damn government with what I can do and what is too much for some other company to pay. It's not their job to say that that company needs to pay that much. It's not. It just isn't. And it's that simple. The government has no right to tell these businesses, as they are businesses, what they can or cannot do. That's not right.
A new push for single-payer health care right here in the U.S.
California and others are saying maybe we should adopt the European model.
If we decided to create a single-payer system with one of these huge price lists in the U.S., there'd be nothing to stop lobbying from hospitals, from doctors, from drug companies, and those prices would get influenced. So we could end up with a single-payer system that is expensive, even as expensive as our current system. It all depends on how much you negotiate down the prices. And now in America, these groups have so much power because they are so rich that it's really hard to get them to bring down the prices. This is the irony of American healthcare. It's so expensive that it's become hard to make it cheaper. All that money they make, that becomes political power. And years and years.
All that money they make, huh? All that money that the company makes whenever doctors make over $100,000 a year. And generally speaking, hospitals have over 20 doctors on file at a given time, depending on how big they are. That means that's about $2 million alone. It's not even looking at all the other things that they need. The building, the constant new technologies that are needed. But yeah, they have so much money, right? They have so much money from us paying like $5,000 for a surgery. Yeah, they have so much money lying around after paying $100,000 surgery, or not surgeries, $100,000 plus in some places payrolls per year, per person. That no, just no. And on top of that, you talk about the private sector as if it's a terrible thing, but we see that throughout the world, the private sector is not a bad thing. And in Europe, the only reason that they have the ability is because they tax the hell out of their people. And so their government has a bigger percentage of their overall GDP that they can spend from taxable income.
And years of overpaying, those are huge industries now, and they have a lot of influence in Congress.
So hold on. Are you sure that this is the private sector or the public sector here? Because I'm very sure that those people in the public sector that the government interacts with will have more lobbying power in the government than those in the private sector. I'm very sure. Those who literally interact with the government to say, our prices will be down here, not up here. We'll keep them down here for you, buddy. Those are the type of people you think won't have more power than the private sector in our Congress? What the hell is wrong with you?
Under a single-payer system, if we did drive prices down, doctors and hospitals, they would be paid less than they are right now. That might mean some of them close, or some go out of business, or some move. It would be really painful. One person's waste is another person's essential service, or local hospital, or their income. But then single-payer, it's not an all-or-nothing choice. For instance, there's a really interesting section of Bernie Sanders' Medicare for All bill, where he lays out this interim plan. It's a plan he wants while he's setting up his new single-payer system. And in that plan, he expands Medicare to cover vision and dental, and he opens it to nearly everyone, not just people 65 and older. All kids go on Medicare automatically, and most adults can buy in. That plan on its own, it wouldn't get American healthcare spending far down overnight, but it would at least begin to recognize what we already know, and what most other countries already do, that healthcare is one of those things the government can do cheaper and better than the private sector.
Okay. I want to go through and go back to the last thing he said. He doesn't address how much it's going to cost to do all of this. He doesn't address how anything else really works. And I'm just going to put this right in the middle. He also simply does not address that the government can't do exactly what he said it can. And the government has proven that. By the VA and etc. And now, I personally use Medicaid. And my grandmother, she uses Medicare. But not Obamacare. Okay? We don't use that. I'm glad we don't. Because our premiums would have skyrocketed. But I digress. Let's get back into this. So, in this country, you say that our government can do healthcare better than the private sector can. How? Show me your facts. Huh? Or is it the government forcing the private sector to have to raise prices to keep up with them? To keep up with the lobbying power of the public sector? Which one is it? Because I would say it would be the latter. If they have people who constantly talk with the government, you think they're not going to get power with the government for their own free health care, for bribery, etc.? Anyway, go ahead and comment down below. Let me know what you think of this video. I don't get political a lot. I am somewhat religious in a majority of my videos. But let me know what you guys think. And I'll see you all in the next video. But this was just one that I thought, yeah, I should do that. It's too crazy not to do. Because apparently the private sector can't compete based on his words and his actions to the public sector. Despite the fact that wait times are extremely low in the private sector, comparatively to the public sector, even in America. So, yeah. Like, comment, subscribe, all that good stuff. And really just let me know what you guys think about this video. Let me know what you guys think about single-payer healthcare and about healthcare in general, because I want to know. And I'll see you all in the next video. Goodbye.